Hello, everyone. Welcome back to another episode of Ask Dr. Ted. Today is March the 8th, Wednesday, and 2023. And again, welcome back. Good to see you again. Today, I thought we would talk about sore throats. This is something you're going to see, you've had, we've all had them. We hate them. Winter's the most common time. I've been doing a whole bunch of shifts. That's why I didn't do these videos for a couple of weeks, because I was traveling and working, and I was home for like 3 days. Went back again, rural America, and working in the ER. I saw a million sore throats. So we're going to talk about sore throats today, okay? First of all, let's go over something first before we go into that. This is a basis foundation of a lot of different things we're going to talk about that we can teach you about. You think about it, when you're still inside your mother, inside your mother's womb, and you're just a fetus, and then eventually you get bigger, your baby, that is a sterile environment. Inside your mother's womb, there's no germs. There's no bacteria. There's no funguses, parasites. There's some viruses that can spread, but that's beyond this scope. But it's a sterile environment. You don't get bacterial infections inside mother's womb, right? But then when you're born, you come out into this world of germs. It is a world full of germs. Germs are those things your mom always told you, wash your hands, you got germs on your hands. The most common germs are bacteria. They're everywhere. There is no, I don't know if you remember in school, you'd take a Q-tip and you can touch anything, any part of your body, anything in the room, anywhere you touch, and you put it on one of those little culture plates and see if it grows bacteria, and it'll grow bacteria. Right? You put it in the incubator and you come back the next day and it smells horrible. Those bacteria smell gross when they grow. That's why we have bad breath in the morning. Our mouths are closed all night and bacteria multiply where our mouths aren't open. We're not swallowing secretions very often. So you wake up with a lot of bacteria in your mouth. And so we always have bad breath in the morning. That's those bacteria that have grown. Well, we have bacteria. There are viruses, funguses, parasites. There's a whole bunch of other things that again, not going into too much depth. So we're born into a world of germs. Our body's job is to keep all the good things in the body, like blood and organs and everything else that's good, and keep all the bad things, all those germs, out of your body. That's what it's supposed to do. That's why when you cut your hand, we don't care about the scar. We don't care about the bleed. I mean, we care about bleeding, of course. But the biggest thing is we want to clean out whatever germs, because if blood can get out, then germs can get in. And that's the problem, is anytime you see blood, that means something inside that was good got out. Well, then we know germs got in, and usually bacteria. So we numb you up and we scrub that. We kill all the bacteria. We want to wash them all out, and then we'll close you. We know there's going to be a scar, but the biggest thing is we don't want to get infected, because infection will spread, right? It's just like we go to the bathroom and we eat, drink, and go to the bathroom. That's what people do. Animals, everybody does it. We produce waste product. We flush it into the plumbing. The bacteria and viruses, they eat and drink also, but they flush their toxins into our bloodstream, and the blood picks it up and it can go everywhere. That's why we get fevers, we get achy muscles when we get a sore throat or a flu or a cough or COVID. We get achy muscles because blood picks up that germ and blood goes everywhere, so the germ goes everywhere, makes you feel crummy. Okay, so that's our body. We're born into a world of germs. Our body's job is to keep everything good in and everything bad out, right? So think about when you get a glass of water, right? Here's a picture of somebody getting a glass of water, and we think our water's clean, and it is, right? But then if you put a filter on it like this, you could buy a filter and put a filter on your water faucet, and you think your water's clean, and then you open that up after a month, and there's debris in there. There's, might be a little pieces of flecks of things. Maybe it looks like sand or dirt, and not a lot, thank heavens. But you realize they wouldn't sell filters if there wasn't something in the water. No matter how perfect our water is, there's always some germs. Guess what? Our body has the same thing. They're called lymph nodes, okay? Here's an example of just the head and neck region. Can you see that? Do I have something I can point with? Hang on. I'll point with this. In your head and neck region, look right there. There's a big one right there. They can be anything as small as a clipping of a fingernail, or they can be as large as your tip of your finger or the tip of your thumb. And anytime you get any germs in your ears, your eyes, your nose, or throat, and they're bad germs, those, just like that filter filters out your water and makes it clean, your immune system picks up any of those germs. They get picked up by the blood and the lymph system, it travels down these little vessels, and you can see it gets picked up in here, right? Those are lymph nodes. You have about 300 from here to here, right? And anytime a germ gets in there and your immune system gets in there, they start battling it out and they get bigger and they get tender. So the first thing the doctor does, if you come in with a sore throat, he's going to come up and he's going to go, well, let me just feel your lymph nodes. He's feeling right along this chain. There's a chain that goes right down that muscle that helps you turn your head, that muscle right there. Can you see that muscle right there? That goes right down that chain of that muscle, and some that go in the back and some behind their ears. They're feeling that because that's a clue. If you've got a lymph node and it's really small and it's not tender and it doesn't hurt and it's hardly anything, it's probably not an infection causing your sore throat. It could be allergies or just a sore muscle from you picked up something, a stomach flu or something like that. If, however, he goes in there and he feels this big lymph node, so right, the doctor, first thing he does, comes in, starts feeling here, feels behind your ears, he'll feel down your neck. He's trying to feel for lymph nodes. That's a clue that you got bacteria in there and they get bigger and they hurt. And people can say, yeah, I feel a bump right there. The scary thing is, and this is what everybody worries about, guess what else can get caught in there? Anything that's not supposed to be in there. So germs, of course, cancer cells can get caught in there. The good news is I can count on two hands the times I've felt cancerous lymph nodes. I felt a million sore throats. And I've felt a million bacterial ones. I've only, on two hands, I can count the times I've felt cancerous lymph nodes. And trust me, you know, they're not little, they're big. They're as big as your thumb. They're that big, they're rock hard, they don't move. You would know. And generally, they're there for a while. And the funny thing is, they don't hurt. Cancer lymph nodes don't hurt. They're painless, large, and you know. And if you feel anything like that, go into your doctor. And if you're not sure, go in. I love when people come in and we go, no, that's a bacteria or a virus. It's nothing scary. And if you felt enough of them, you just know. So there's our immune system working on infections, okay? Little filter system. And let me show you what a normal throat looks like. Let me get the lid off of this so I can point better. Here's what a normal throat looks like. It can look like, so you have your tongue right here. You have that little round ball thing there. That's a tonsil. And look at this one. That can also be the way, it says sore throat here, but this could be a normal tonsil. Tonsils are those lymph nodes. That's just two of those lymph nodes we were just talking about, that chain. Two of them are your tonsils. And you might have an infection in there, but some people just have normal tonsils. That's how they look. They're just big. We call them kissing tonsils, right? They're touching almost. And you're thinking, how does that kid sleep or that guy or lady sleep or swallow? Well, they do just fine. If they get inflamed and infected, and they get bigger, yeah, then sometimes you talk about having your tonsils out. But this is your tonsil right there and right there. There's also a tonsil like there, a big one. And some people's tonsils grow in, more outside. Some grow inside. And you're seeing two examples right there and right there. The back of this, see there's your uvula right there. Your uvula, it's the little punching bag at the back of your throat. Behind that wall back there and right there, that's your throat. So that's your tonsils, that's your throat, that's your uvula, there's your tongue. So when somebody says they have a sore throat, first thing the doctor wants to determine, is it a tonsil that's enlarged? Is your uvula swollen? Maybe your tongue's large. There's things that cause your tongue to be sore and it's not your throat at all. Could be a bad tooth, an infected tooth, or something like that. So the first thing he's going to look at, or she's going to look at, your doctor, is tonsils, throat, uvula, tongue, mouth, all that kind of stuff, okay? So the common ones that we see, everybody's going to think of strep throat, right? So let me just show you three different examples of strep throat. I've seen all of these. This one, any question on that? You think that looks normal? No, that's cream of mushroom soup coming out of there, right? You see cream of mushroom soup, and look how big those tonsils are. There's the uvula. It's even a little swollen, but look at those tonsils. Those are huge. They might even have an abscess behind there, a little pocket of pus back there, and it's pushing the tonsils in even further, and sometimes you got to take them out immediately because you worry about them breathing, and they could lose their airway. I've seen that. I see those all the time. My son-in-law had one time like that. Look at this. That's also strep throat. A different presentation of the exact same bacteria, exact same thing. Well, how come one looks like this and one looks like that? Just different reactions. Different bodies handle bacteria differently. And look at this one. The tonsils, kind of bigger, but not so much. But look at these red dots. You have your hard palate up here where the roof of your mouth is. There's bone up there. The back of your mouth is the soft palate. It's soft, and that's where it can move, and it helps you form words. You get these little ruptured or inflamed blood vessels. You get these little things that are called petechiae. If I see this, or I see this, that's easy. You don't even have to swab those people. Why swab them? $100 to tell you it's strep throat or a bacteria of some kind. It may be strep. It may be, there's a dozen different bacteria that can make it look just like this, not just strep, right? So if I see that or I see that, I just write the script. You don't even need to swab them. But guess what else strep throat can look like? Look at that. That could be strep throat. That's a totally normal throat. Have you noticed one thing? No tonsils. This person had their tonsils removed most likely, or they're grown so far deep inside that you can't even see them. I've seen that. But this guy probably had his tonsils removed, or she. And look, there's your throat. Throat looks good. No tonsils. Uvula looks good. Everything looks good. That's a totally normal throat. But then you come in and you say, but my sister had strep, or my other kid had strep, and they've been playing together, and he's got a sore throat. This one, you're going to swab, right? You're going to swab that and test it to see if it's strep throat. The problem with the strep test, it's about 80% accurate. It's not 100%. So you can say, it can say negative and you can still have it. Sometimes you just use common sense. You've been playing with a kid with strep, you got all the symptoms, achy muscles. That's the other thing with strep throat. You feel crummy. You feel like you have the flu. You feel achy and sore. Now, here's the scariest thing of all. Guess how many people just normally carry strep, the same strep that causes strep throat with those pussy tonsils, right? About 3, 4, 5% of the population just carries it normally. They don't get the symptoms. They don't get sore. But if they play with somebody or they chew on something and somebody else says it, you can pass it on. You can be a carrier of strep. So do you get the feeling that there are no cut and dry answers in sore throats? They're hard sometimes. Sometimes it's obvious, like those two we showed with the little petechiae and the little cream of mushroom soup. Sometimes they look just like this and you have to swab them. And even then, the test might not be accurate, right? So there's no perfect answers. Here's one that's kind of a scarier thing, and this is a rare thing, thank heavens. Here's a healthy throat. There's no tonsil there. The throat is the thing at the very back behind all of that. Look at that one. Look at that guy's tonsil. He's got a pocket of pus right there, an abscess, a pocket of infection. It looks like cream of mushroom soup. If you poke that, it'll drain out. And I used to take out tonsils, and both tonsils sometimes can have a dozen of those, just little ones, and they're never going to get better. You just have to take their tonsils out, right? So the biggest thing you worry about is an abscess. If you see somebody that looks like, let me show you, there's a good picture here. If you see a kid that looks like this, his mouth is open, his head's forward, he doesn't want to, he sounds like he knows he's got trouble breathing. His tonsils are going to shut down maybe. Or a little kid like this leaning forward, their mouth's open, they're drooling. You see a little kid drooling, that's a bad sign. You take them into the doctor. Thank heavens, again, this is rare. I've seen dozens and dozens of these, but I've seen millions sore throats, right? So thank heavens this is not very common. A drooling kid that doesn't want to close his mouth, doesn't want to lay back, that's a danger sign. Okay? Let me show you one thing that is not strep throat. And maybe you've seen this. Look at this. What is that little guy right there? This is a guy or a lady that will come in and go, what is this thing? I must have strep. I've got this thing. And I'll say, well, how do you feel? I feel fine. I feel fine. Do you have a sore throat? No. Are you sore and achy? No. Just got done golfing. Just got done playing basketball. Well, what's this thing? It must be an infection. No, that is a tonsil stone. And we've all seen these. Maybe you haven't seen it. There's another tonsil stone. And there's one out on a guy's hand. Sometimes people come in and they'll say, I coughed or I sneezed and this darn thing came on my hand. And I don't know why we do this. We know it's gross, but we always break it and smell it. Ugh, you're right. It's gross. It's what it is your tonsils are kind of like an orange, and somebody took a McDonald's straw and poked holes in your tonsils. If you have tonsils, go look in the mirror and you'll see there's these little holes or these little crypts, these little holes in your tonsil, and that's where food can get in there, food debris can get in there, bacteria can get in there, your saliva, and it forms these little, they're not really stones, they're more like cottage cheese, but they get in there, and then you'll cough or sneeze, and it'll come out. And then a week or a month later, you'll get another one. One time, I am not kidding you, this is a true story. I had a guy call me at 3 a.m. in Utah. He was in Hawaii. It was 11 in the evening in Hawaii. And he called me and said, I've got this white stuff on my tonsils. I think you should call an antibiotic in for me. He's one of my patients. And I said, well, how do you feel? Oh, I feel fine. Are you on vacation? Yeah, we went swimming. Everything's fine. I got this drainage on my tonsil. And I said, do you have a sore throat? No, I feel fine. No fever, nothing. I said, it's probably a tonsil stone. And I said, by the way, what time is it there? And he goes, so it's about 11 o'clock at night. And I said, well, it's 3 a.m. in Utah. Thanks for calling me. That's, he's on vacation. His brain's on vacation, I guess. But anyway, so that's not strep throat. That is a tonsil stone. Don't go see your doctor for that. And good luck. You can get a butter knife and kind of try and get out of there, but it'll come back. If you get them all the time and they're bugging you, you can have your tonsils removed. Then what other thing I wanted to say? Okay, so basically, in a nutshell, here are the causes of sore throat. Gosh, I got so much glare there from everything else, but look what I put. Causes of sore throat, virus. Most sore throats are viral in origin. Look how tiny I put strep throat. And then other things, allergies, or maybe you have stomach flu and you get a sore throat. It has nothing to do with your throat. It's the muscles behind the throat that are sore. When you swallow, there's like 20-something muscles involved in the process of swallowing. If you got the stomach flu or a virus or something, or influenza, those muscles get sore. So when you swallow, it hurts. It's not bacteria, it's just a virus. Sometimes just a dry, sore throat. Maybe you fall asleep and your your nose is plugged and you're breathing through your mouth all night. A dry throat can be sore. So almost always, if you have a sore throat and a kid with a fever, it's almost always viral. If you look and you see, we'll go back to those real quick. If you see that, right, you don't need me to tell you, go in. If you see that, you go in, right? If they've been playing with kids with strep and they got all the symptoms and they're achy and got a fever, okay, take them in and they'll swab it and check. But if you see, sorry, should have had this more organized here. If you see this, your kid has a sore throat. Oh, I zoomed in, sorry. We have not a very big budget here on Ask Dr. Ted. If you see that, normal looking throat, how long has they had a sore throat? Oh, a couple days. How many is a couple? 1, 2, 3, maybe even 4, and they look like that. Just give them some Tylenol or some Advil or both. You can give them both and give it a couple of days. And if it goes away, you just saved yourself a ton of money, a ton of time, and almost all of them are viral. They almost always go away. And again, if you have any questions, just go in. Your doctor loves seeing you. I used to love seeing people say, nope, just a virus. Good news. You don't have to take anything. Tylenol and Advil. And that's good news. So anyway, we'll do one. I'm going to do one on mono because everybody talks about mono, the kissing disease, right? Yeah, you can get it from kissing, but there's other ways. We'll talk about that. So hopefully that was helpful for you. It saved you some time and money. Kids with a sore throat, even with a fever, don't worry about fever. Fever is just a symptom. It's your body's way of fighting it. It's not going to hurt them. Treat it with Tylenol or Advil so they feel better, but you don't need to worry about a fever or a sore throat. Give it a couple of days if it looks normal. Normal looking throat, give it a couple days, 2, 3, 4 days. If it doesn't go away, go in. If it looks pussy or has those red dots and they just look really terrible, go in. Fine. There's no fault ever going in. We love seeing you, but I thought maybe we can save you some time and some money. Okay. Good luck to you, and hopefully that helped you, and we'll see you next time. Bye-bye.